Mistreatment. That's what one veteran received at the VA hospital, according to her caretakers and a federal lawmaker.
They all want answers, and they've asked Contact 13 Chief Investigator Darcy Spears to tell this story to help ensure no other veteran goes through the same thing.
Thursday, December 12th. 78-year-old Navy veteran, mother, medic Sandra Nickum is laid to rest, surrounded by friends and admirers.
Sandy Nickum was a wonderful advocate for any veteran. She was outstanding with blinded veterans.
Blind herself as a result of diabetes, Sandy dedicated more than 5,000 volunteer hours to the VA Southern Nevada health system. Her house is filled with photos and memories of a life of service, but her death and the time leading up to it is the story her caregiver and aide are bound to tell.
And I told her, I said, Sandy, please, I don't want to tell this story. And she said, Dee, you have to.
The Review Journal first published the story at Sandy's request.
She wanted this article and this newscast because she did not want any other veteran to go through what she did.
Sandy's ordeal began in the late summer with a visit to the VA hospital's emergency department for some tests.
We got checked in to ER, and we waited at least 4 hours.
Shirley Newsham says Sandy, a brittle diabetic, never went anywhere without her insulin kit. But Shirley says staff at the VA hospital told Sandy,
if you're not going to give up your medicines, then we're going to have to escort you out of the hospital.
Hospital Director Isabel Duff denies that, but she cautions
patients who take their own medication in an acute hospitalization, that's just not something that happens because it can interfere if we don't know. We could actually cause her great harm.
Sandy had to go back to the hospital on October 22nd for more tests as her health continued to decline. Dee says the nightmare started all over again when radiology couldn't find Sandy's orders in the computer.
The gentleman got up, and Sandy was sitting there, and he slammed the window down.
So it was back once again to the ER, where Dee says the nearly 6-hour wait pushed Sandy over the edge.
And that's when she would just hit her cane on the floor and say, please, God, please, somebody help me. Please, some doctor, help me, help me. No one even cared. No one even looked up. I just thought, wow.
These pictures document Sandra Nickum's state as she sat waiting in the VA's emergency department.
This was so terrible. It was a nightmare. That's why I took one of the pictures on my iPhone that this was really happening, and to her.
The VA admits it can improve on treating special needs patients. Though patient privacy laws prevent them from talking about the specifics of Sandy's care, Isabel Duff says the veteran and her aides got it all wrong.
Her chronology does not match what we have documented.
What about her constant pleas for help that they claim were ignored?
Well, what I can tell you is the document, our notes show continued intervention and assistance and treatment, even ongoing. During a time that the ED was very, very busy and her evaluation was progressing.
She says Sandy misunderstood doctors' orders and refused care and offers of assistance that could have made her experience better.
I can tell you that her care was appropriate. You've pointed out that what I'm hearing is that Sandy reported that she didn't feel that she was treated appropriately. We are looking at that.
Dina Titus and other members of the House Veterans Affairs Committee are also looking at Sandy's case. Congresswoman Titus sent this statement saying, "I was appalled to learn of the shocking mistreatment of a veteran who had given so much to our country and community. I am eager to learn the results of the hospital's working group and the actions they plan to take to ensure no other veteran suffers from a similar experience."
Sandy died November 15th due to complications from an earlier diagnosis of colon cancer. Her suffering is over, but her story and her service will live on. Darcy Spears, Channel 13, Action News. The House Veterans Affairs Committee has asked the VA for surveillance footage so they can see Sandy's ordeal for themselves. Darcy will stay on top of their inquiry.
In her first interview with the Review-Journal since taking the reins of the Veterans Affairs Southern Nevada healthcare system, Director Isabel Duff discussed the emergency room ordeal experienced by blind veteran Sandy Nickum as she waited for treatment of a colon condition a few weeks before she died on November 15th. A witness who escorted Nickum to the North Las Vegas Medical Center said the 78-year-old Navy veteran cried for help while she waited in pain for 6 hours on October 22nd, only to return 2 days later to finish tests.
She was having an evaluation completed, and that does entail waits for information to be able to come back to provide the appropriate medical care. And some locations are better than others for treating those evaluations. We take the patient preference and try to work with that. And in this case, there was a patient preference.
In the interview Friday, Duff revealed that video surveillance footage requested for an Inspector General's probe essentially doesn't exist because a contractor hasn't been able to retrieve the video.
The videotapes are not available. There is an automatic deletion, and I'm not going to give you the time frame because I want to make certain that I give the accurate time frame. What I did do was, when we couldn't retrieve them, we contacted the contractor to see if there was anything that they could do in order to, what would you call it, recover them. And so the contractor came and tried to recover, and that digital tape is no longer available.
Duff offered her perspective of the situation and expressed her expectations of what she hopes to accomplish as she guides the local VA healthcare system and its staff into a new era.
As I said, I accepted the position here September 22nd. Las Vegas is now my home. This is now my facility. And one of the things that I have experienced being here, and Las Vegas is a big city, but it has a very small town feel to me, which is really good. The VA is very important. There is a real caring and support for veterans and for VA here, which is critical to our success. We need that support. We can't do our work without that. Can we make everybody happy all the time? No. For me, the mettle of an organization is how does it respond when something goes wrong? Now, if something goes wrong and goes wrong and goes wrong, and things are not put into place, something can happen, and what I count on is that those safety nets don't allow it to continue. Where I'm concerned is if something happens and it goes through another pair of hands and another pair of hands and another pair of hands, and we didn't take that opportunity to stop it. But you're right. We are people taking care of people.
Thanks for joining us. After serving their country, some Las Vegas veterans feel betrayed here at home.
An uproar from that community over mistreatment at the VA Medical Center in North Las Vegas has sparked an investigation, and it could lead to changes in veteran medical facilities across the valley. Brian Brennan has more on some of the shocking complaints.
Allegations of rude hospital staff and extraordinarily long waits have been in the news for months. Since then, more and more veterans have come forward. The people we talked to say they are hoping changes will finally be made.
I corrected it.
Chris Christoph doesn't keep photos of his time in the Marine Corps. He tries not to think about the friends he lost in North Korea. But every day, old injuries serve as a reminder.
Where the Jeep flipped over caused my leg to get torn apart.
War wounds have gotten worse with age. He says complications with arthritis and his hearing have made him very familiar with long waits and poor attitudes at the VA medical facilities across the valley.
It's like you're in the military. You sit down, shut up, and hope that somebody takes notice to you.
A service officer at the VFW post near Nellis Air Force Base works with veterans every day. He says complaints like Christoph's are far too common.
A lot of my veterans are complaining. They'll go enroll, and then what happens, they tell them, oh, we can't get you in to see a primary care doctor at least for 6 more months. Well, What do we do for 6 months?
The House Veterans Affairs Committee is already investigating the VA Medical Center in North Las Vegas after a reported case of mistreatment. Congresswoman Dina Titus says she's talked to the director of all the VA medical facilities, Isabel Duff, to make sure changes are made.
She knows that that's unacceptable and that we want our hospital to be the gold standard for both caring and customer service.
Chris Christoph says veterans deserve to have the problem fixed.
We all make mistakes, and they do not own up to their mistakes.
He also says they deserve an apology.
A spokesperson for the VA Southern Nevada health care system called us back just a few hours ago. He says he could not comment on the specific investigation at the VA Medical Center in North Las Vegas, citing HIPAA laws, but did say if they ever find flaws in their system, they work to fix them.
I think every person in this room knows the seriousness of this problem, but I specifically want to underscore how this is affecting veterans in Nevada. 4,000 veterans in Reno, Las Vegas, across Nevada are waiting for their VA target deadline of 125 days for their claim to be delayed, to be completed. They're waiting more than 125 days. On average, Nevada veterans wait 436 days to have their claims completed, and this is the longest wait of any regional office in the nation, and I think we can all agree that this is unacceptable. But I think it's important to me and my constituents to bring this one particular story to your attention. A Las Vegas veteran wrote me recently, I'm just one more disabled veteran still fighting the appeals process with the VA. I understand now that no one is going to expedite my appeal, and I will probably die before I get any successful resolution. But there are a huge number of vets just like me, and some in worse shape. None of us deserve to be put on hold forever. Frustration. And that is what this veterans and veterans across the nations are feeling. The reality is that the VA has a 1945 process. This outdated process no longer makes sense for the VA and for the veteran. Looking back at 2 decades of VA backlog, I found the VA has always fixed the problem with short-term solutions rather than asking the difficult question of whether the entire process needs to be updated. No longer makes sense to point fingers and to place blame as we have for quite some time now. Instead, Congress needs to meet and give the VA and regional office the tools and resources they need to bring the backlog down. But this cannot be done without an open, frank discussion about what's working and what's not. Our nation owes it to veterans to resolve this problem together, keep our promises, to care for them when they return home from war.